Hello, welcome to The Moment. This is going to be a long episode with a lot of statistics in it, but hopefully you find it interesting. This time I'll be looking at recent findings that more people in their 50s and 60s are being admitted to hospital for alcohol-related reasons. And I'll also be talking about the red squirrel population in the north and the biggest threat that they face. So let's turn to the first story. Alcohol and its relation to long-term health has been featured in the News Post Leader recently. According to the story from the 30th of August, quote, around half of all alcohol-related hospital admissions in the northeast are for people over 50, according to an analysis carried out by Balance, the Northeast Medical Office. It comes as a report recently released by the British Medical Journal found a strong upward national trend of heavy drinking among this age group. Northeast alcohol-related admission rates have not risen as fast as the England average, but the region still suffers from rates that are significantly higher than the England average. And despite a fall in the rates of younger people admitted to hospital for wholly attributable alcohol-related conditions, admissions for people over the age of 50 have risen from around a third of the total in 2006 and 7, 35%, to 51% in a decade. Now, this article in the Leader is simply a copy and paste job from Balance's own website. So let's take a look, before we go any further, at who Balance actually are. On their About Us section on their website, they say, quote, we do want to encourage people to reduce their consumption and reduce the impact that alcohol is having on our region. This is achieved by three key areas of activity: education and informing, giving you all the information and support you need to make you aware of and understand the issues related to alcohol so you can make informed choices. Sharing best practice, looking at successful projects or ways of working that are having a positive impact and sharing them. Calling on government for change, asking them to adopt those measures which robust international evidence tells us will reduce the harm caused by alcohol misuse. And as far as their funding goes, they say, quote, Balance is funded by the Northeast's 12 local authorities. The organisation also brings together a number of other partners and stakeholders, including local authorities, health services, police forces, emergency services, voluntary agencies, alcohol support groups, treatment services, and prison and probation services. So that's Balance. And while there's nothing untoward about any of this, it's still good for you to know where that original story comes from, since, as I say, the article is a copy and paste job from this group, who obviously do have an interest in telling people the negative consequences of alcohol. So with that in mind, let's take a look at an NHS presentation called Statistics on Alcohol, England 2017, from the 3rd of May. The introduction says, this statistical report presents a range of information on alcohol use and misuse by adults and children, drawn together from a variety of sources for England. It includes data from the Office for National Statistics and Public Health England. Part 1 of this presentation looks at alcohol-related hospital admissions specifically, and slide 6 of the PowerPoint explains, quote, two measures for alcohol-related hospital admissions have been used. Narrow measure, where an alcohol-related disease, injury or condition was the primary reason for a hospital admission, or an alcohol-related external cause was recorded in a secondary diagnosis field. Then there's broad measure, which is, quote, where an alcohol-related disease, injury or condition was the primary reason for hospital admission or a secondary diagnosis. The narrow measure is a better indicator of change over time because it is less affected by improvements in recording of secondary diagnoses. The broad measure is a better indicator of the total burden that alcohol has on health because it uses both primary and secondary diagnoses. So, looking at the narrow measure results for estimated alcohol-related hospital admissions for 2015 and 16, it says, quote, there were 339,000 estimated admissions related to alcohol consumption. This is 3% higher than 2014 and 15, and 22% higher than 2005 to 6. This represents 2.1% of all hospital admissions, which has changed little in the last 10 years. Looking at the admissions by age, the stats do seem to correlate with Balance's statement that it's people in their 50s who are more likely to be admitted to hospital due to alcohol. The statistics report reads, the number of admissions rises with age up until 45 to 54 and then falls. 39% of patients were aged between 45 and 64. Now, again, this is the narrow measure statistics, and I will be looking at the broad measure stats as well to compare the difference, if any. But looking at the admission rates per 100,000 population slides, it reads, quote, Blackpool had the highest rate at 1,160 per 100,000 population, and Kingston upon Thames had the lowest rate at 390. As for admissions by diagnoses, quote, almost a quarter of admissions were for cancer, 22% were for unintentional injuries. So those are the narrow measure statistics for 2015 and 16. Now let's go through the broad measure stats, which take both primary and secondary diagnoses into account, so the numbers will be, of course, larger as a result. Slide 10 reads, there were 1.1 million estimated admissions related to alcohol consumption. This is 4% more than 2014 to 15. This represents 7.0% of all hospital admissions, which is similar to 2014 to 15 and 2013 to 14. 45% of patients were aged between 55 and 74. Again, the stats show that Blackpool had the highest admission rate per 100,000 population, this time at 3,540, but it says that the Isle of Wight had the lowest in the broad measure range at 1,400. It concludes by saying that half of admissions were for cardiovascular disease, 18% were for mental and behavioural disorders due to alcohol. The stats continue then to go on to talk about deaths, prescriptions, and other alcohol-related stats as well. And I will be linking to the full document, so if you're interested, you can read it yourself. So it's possible to see from this the effects alcohol has on the health system, and that, like Balance says, the largest single age group is from around 54 to 60 plus, depending on which stats you're using. And the North East definitely does have the highest rate of hospital admissions than anywhere else in England, with its admission rate being in the 850 to 1,160 per 100,000 population range. As to potential reasons why people in their 50s and 60s are more likely to drink heavily, Balance's director Colin Shavels in the original article says, quote, we're now seeing serious consequences for an older generation who have easy access to increasingly affordable alcohol. Alcohol is 60% more affordable than it was in 1980. And this stat that Mr. Shavels is using, again, comes from this same NHS presentation that I've been quoting from, where it does indeed say, in the UK since 1980, alcohol has become 60% more affordable. However, it also says, over the last 10 years, the price of alcohol has increased by 33%. The price of alcohol increased by 0.3% relative to retail prices, while real households' disposable income increased by 12% over the same period. As a result, alcohol has become 4% more affordable since 2006. It goes on to say, UK household expenditure on alcohol has more than doubled to £19 billion in 2016 from £9.2 billion in 1985. However, alcohol expenditure as a proportion of total household expenditure has fallen to 1.6% over the same period, from 3.8% in 1985. As for average weekly expenditure, the presentation reads, average weekly household expenditure on alcohol was £7.90 in 2014. People in the 50 to 64 age group spent the most, with an average of £10 a week. The lowest weekly expenditure was by those aged under 30, with an average of £5.10. It would seem then that Mr. Shevels is correct in his assessment that it's this older generation which simply has greater access to alcohol that's more affordable than previously, and that this is what's causing these severe health problems. However, I'm not entirely convinced about Mr. Shevels' suggestion in the Balance article that, quote, we urgently need the government to take action by introducing targeted evidence-based measures, including the introduction of a minimum unit price which would increase the price of the cheapest, strongest alcohol products. Mr. Shevels seems to believe that this would, quote, help tackle the problems at source, but I'm not entirely convinced of that. If this demographic has the disposable income necessary to buy alcohol, then they'll buy it regardless. And, even so, as the statistics that I just read showed, the average price of alcohol has actually been increasing anyway over the last 10 years, and that clearly hasn't done anything to dissuade this particular group. In fact, if anything, it seems that the numbers of hospital admissions have been getting worse. So clearly, simply raising the unit price isn't actually going to do anything to stop this trend. It seems to me that what Balance should really study are the reasons behind this particular age group's drinking, beyond just its availability, as of course the minimum unit price rise would actually affect other age groups who don't seem to have such a great problem with alcohol-based illness as the older generation. And again, also, the increased affordability that Mr. Shevels is talking about is not actually because alcohol is cheaper in and of itself, but because the average household disposable income has increased as alcohol prices have increased. So by consequence, the alcohol is more affordable, and therefore raising the minimum unit price wouldn't actually achieve anything with regards to dissuading this group from acquiring alcohol. So now let's move on to the second and final story. This week, The Independent published an article titled Britain's Last Red Squirrel Population Being Infected with Deadly Virus After Killer Greys Infiltrate Protected Area. It goes on to say, grey squirrels are killing off their red counterparts with a deadly virus in the Lake District. A population of 30 red squirrels living in Grasmere has fallen to 12 after grey squirrels managed to infiltrate their mountainous territory. Now, this certainly sounds very grave, but before I look at this squirrelpox virus, which is the culprit virus here, it's worth taking a look at the population overall of red squirrels and the danger that they face from grey squirrels. The native red squirrel has been threatened by grey squirrels since their introduction to the UK in 1876. The organisation Red Squirrels Northern England has a page on their website where they talk about how the grey squirrel came to be so successful compared to the red. It reads, quote, greys are roughly twice as heavy as the red squirrel and can tolerate living in much denser populations than red squirrels in mixed and broadleaf woodlands, with greys achieving up to 15 individuals per hectare and reds achieving up to 2 to 3 per hectare. Grey squirrels evolved on the eastern seaboard of America in oak and hickory forests, As a result, they have developed a resistance to tannin, which is found in seeds such as acorns. Unripe acorns are particularly rich in tannins, but are a high-energy food source. Red squirrels find tannins unpalatable, so grey squirrels can decimate crops of acorns before they ripen and become a viable food source for reds. And Red Squirrels Northern England have produced a report recently on the results of their monitoring program for spring of this year. The first paragraph reads, quote, "The aim of the annual monitoring program is to build a standardized long-term data set that will evidence changes that may occur to red and grey squirrel range over time. The geographical focus is northern England, in interface areas where both species may occur, and in areas where grey squirrels are managed to help preserve the status of reds." It goes on to say that data is collected in the same locations using the same methods, recording both positive and negative data based on detection or non-detection of squirrels at fixed points along survey routes. The report draws a distinction between areas that they call strongholds and the wider landscape. The latter is, of course, what you would expect, but strongholds are referred to as specific safe havens. Quote, "The red squirrel reserves consist of largely coniferous forest plantations where red squirrels were thought to be at less of a disadvantage to greys than in the surrounding landscape." And it should be mentioned that there are 7 stronghold complexes. These are Kyloe, Slaley Complex, Harwood Complex, Kielder Complex, the Yorkshire Dales, the North Lakes Complex, and Sefton. So those are the 7 stronghold areas that their survey results cover. And there is a map in this document, which I would recommend you look at, and that shows the location of all 7 of these strongholds. So, looking at the survey results, they say red squirrels were detected in 45.2% of surveys, and grey squirrels were observed in 42.8% of the total number of surveys, which I'll just say here was 294 surveys altogether. Quote, 33.6% of sites were red only, 31.2% were grey only, and both species were detected at the same sites in 11.5% of surveys. No squirrels were observed in 23.4% of surveys. It then goes on to say that red squirrels were detected in more sites within the stronghold areas than grey squirrels, with reds detected in 50.8% of surveys and greys observed in 37.5% of sites. Outside of strongholds in the wider landscape, grey squirrels were detected in more sites than reds, with reds detected in 36.2% of surveys and greys in 51.3%. Now, they do say that some strongholds seem to have fared better than others with regards to the population of red squirrels. They say that, quote, red squirrels were detected in 86.9% of sites in the Yorkshire Dales, the highest percentage total of all the complexes. Detection of greys was low in this stronghold, observed in 17.3% of sites. Only Kyloe has a lower percentage detection rate, with greys observed in 12.5% of surveys, although it should be noted Kyloe has the lowest total number of survey sites, 8 in total. By contrast, the results from their Slaley stronghold were poor, with, quote, reds detected in only 11.5% of surveys. In contrast, grey detection was high, with greys observed in 76.9% of surveys. So this is a rough idea of red squirrel population through these monitoring program, and the report goes into finer results and comparisons between results, but I'll put a link to the report in the description so you can take a look at the whole thing yourself if you want. But just from these results, the claim from the Independent that Grasmere houses Britain's last population of red squirrels looks to be highly inaccurate. So now let's focus on looking at the squirrelpox virus. This is one of the other major threats that red squirrels face. According to the page on the Red Squirrels Northern England website, quote, "It can take only one grey squirrel to introduce this virus to a local population of red squirrels, and the virus can spread throughout the reds with devastating effect. Where a grey squirrel introduces SQPV, red squirrel population decline has been observed at between 17 to 25 times quicker than through competition alone." So to try and understand it further, let's take a look at a paper called Squirrelpox Virus, Assessing Prevalence, Transmission and Environmental Degradation by Lisa M. Collins et al. In 2014. The introduction reads, quote, "In grey squirrels, SQPV, which is of course the acronym for squirrelpox virus, is a subclinical infection that rarely manifests in disease. However, in red squirrels, it causes ulceration with lesions and scabs around the eyes, lips, feet, and genitalia, yet is almost always fatal." It goes on to say that studies using a specialist method for detecting SQPV antibodies, quote, "have demonstrated a high presence of SQPV antibodies in healthy grey squirrels, yet reported an absence of SQPV antibodies in otherwise healthy red squirrels. These findings indicate that grey squirrels are a natural reservoir for SQPV and are capable of resisting the disease, whilst the red squirrel does not appear to have this capability. Red squirrel populations in close proximity to SQPV seropositive grey squirrels have been reported to decline up to 25 times faster than those in close residential proximity to seronegative grey squirrels. However, a recent investigation has revealed the presence of SQPV antibodies in live red squirrels. This finding provides hope for the sustainability of a viable red squirrel population, but also the development of an SQPV vaccine. Despite this, SQPV is considered one of the major contributing factors in the decline of red squirrels throughout the UK and seriously threatens current conservation efforts. So that's just the second introductory paragraph from that article, but I think that rather neatly explains what the squirrelpox virus is and why it's such a threat. And this brings me back to the Independent article. Although the article is accurate in that it mentions the deadly nature of the virus, it seems to be the only article talking about a squirrelpox outbreak in Grasmere this year, and that article was written this Monday. There are a couple of articles about a Grasmere SQPV outbreak in 2015 from Lakeland Radio and ITV News, as well as on Facebook. And the National Trust says on their website, quote, "Last year, an outbreak of the deadly squirrelpox virus in Grasmere put our native red squirrel population under dire threat. We had over 10 confirmed cases of the virus in the valley, but thanks to the constant efforts of the Grasmere Red Squirrel Group and the local community, our red squirrel population has survived." So all of the mentions of SQPV at Grasmere seem to be from a large outbreak 2 years ago, or another one last year. I don't want to say that the independent journalist was using out-of-date information in the story. There may well have been an outbreak in Grasmere this year, but when there are no other search results, when you look at squirrelpox virus in Grasmere and specifically look for this year, it does make you wonder. The takeaway from this whole story here is that there do seem to be many healthy pockets of red squirrels in northern England and of course in Scotland, but that finding a cure for the squirrelpox virus is going to need to be the focus of scientific research into their conservation. And that's all for this episode. Join me in 2 weeks for more from Northumberland and Newcastle. Until then, I'm Oliver Ralph, and this is The Moment.